Alright guys, back with popular demand. This is the part B of your competency-based test for mental health nurses provided by Pearson Vue. So if this is something you are interested in, make sure to keep on watching up until the very end. Hello guys and welcome back to the channel. So if you're seeing me for the very first time, hi, my name is Samuel. I am a registered nurse, a singer-songwriter, and I sort of share a little bit of life tips and some other interesting things that I think you will benefit from on this channel. So if that sounds like something interesting, please make sure to subscribe. Alright, in today's video we will be going through the part B of the new practice test provided by Pearson Vue. It is a mock test. It has 50 questions, just to prepare you with what you will be seeing in the exam, the nature of the screen, everything just to make sure you are well prepared for the exam on that day. Okay, so let us dive right in. So this is what your screen will look like, and then we're just gonna scroll down. These are like basic instructions, but let's just scroll down to select what we want, and you can see there are different aspects here. And don't forget, I've done the part A, which is the numeracy, so if you missed that, make sure to check that out. It's just a few videos back. Today we're doing the clinical part of mental health nursing, and this is just like clinical questions, so we should not be doing much of calculations. I don't think we should be doing any calculation, to be honest. Okay, so make sure to read these instructions because it is very vital in preparing. Right, so I just discovered my microphone was not working, and we need to give you guys the best. I need to give you guys the best. Okay, now that is sorted. Alright guys, so this is what your screen will look like. You will be given instructions, and but this is basically just to prepare you for the exam, like I've said earlier. Now let's go into the main practice test. Which of the following describes a quantitative method of research? You are to choose the correct answer. Now we have things here on the screen which you should take note of. Like, you can flag a question for review if you are not so sure. Don't forget your time and the number of your questions. Then over here we have the calculator, which we will not be needing. Then we have over here the objective, which is like just to help you, give you a hint of the answer, basically just to like give you an idea of what the question is aiming for. Okay, let me click on this objective for you to see. Demonstrates an understanding of research methods, ethics, and governance in order to critically analyze, safely use, share, and apply research findings to promote and inform best nursing practice. So the question says to describe a quantitative method. That is something that can be quantified. So we know that it is not reviewing published research. It is not exploring a phenomenon by interviewing participants. It is collection of numerical data, because that is the only thing that can be quantified in these given options. Then what are the 4 themes of the NMC code? Choose the 4 themes of the NMC's code. Choose the correct answer. I am working on a video, like preparatory materials for this exam, so that you can. I tried doing a live session, but I wasn't my best that day. So I'm thinking of like doing a much detailed video. So option A says prioritize patients, practice within your limits, preserve others, promote well-being. No. Prioritize yourself, practice with pride, preserve health, promote the NHS. No. Prioritize staff, practice safely, preserve well-being, promote health. No. D says prioritize people, practice effectively, preserve safety, promote professionalism and trust. Yes, that is our answer. The third question says, when caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. We know that Jehovah's Witnesses do not like to receive blood. So option A says they are not to be sedated. Option B says they are not to be resuscitated. Option C says they are not to receive blood or blood products. Option D says they are to be cared for by professionals who are JW. Option C is our answer. Actually, this question seems somehow similar to the one for adult nursing. When caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. So option A says to find the information you need from medical notes. No. Option B says to use a face-to-face or online translator. Option C says ask a family member to translate. No, because that's like you are like breaching a privacy, if that's the right way to put it. Then ask patient to draw pictures. No. So our best option is to use a face-to-face or online translator. Next question says, when a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. We have option 1, which says continue your drug round. Option B says inform patient of what has happened. Option C says call the patient's family. And option D says to continue to administer the next dose. Of all the things here, after being assessed for harm, you need to inform the patient of what has happened. And I believe in assessing for harm, the doctor would have also been informed, or pharmacist, or just to seek advice. And our most correct option would be to inform the patient of what has happened. Our next question says, the HPV human papilloma vaccination prevents which disease? Choose the correct answer. A says ovarian cancer, B says testicular cancer, C says bowel cancer, and D says cervical cancer. So I think our best option would be ovarian cancer. Then we'll just go on to the next one. Which of the following professions are specifically trained in smoking cessation? Choose the correct answer. We have option A, hypnotherapist, option B, pharmacist, option C, dietitian, option D, chiropractor. So hypnotherapist, we know it's a big no. Pharmacist, well, they offer medications that can help battle nicotine addiction. Then we have dietitians, then chiropractors. So our best option is pharmacists. So which of the following diseases is notifiable to Public Health England? Choose the correct answer. Option A is mumps, option B is influenza, option C is human papillomavirus, and option D is Clostridium difficile. I was thinking it's Clostridium difficile, but I guess the correct answer should be mumps. Okay, the next question. Which of the following is a health visitor's responsibility? Choose the correct answer. A, giving emergency first aid and treatment in a crisis. B says supporting physical and emotional growth of a child. C says administering immunizations. And D says assessing speech and language development. So I think our correct answer should be giving first aid, emergency first aid and treatment in a crisis. What are the common complications of uncontrolled blood sugar levels in diabetic patients? Choose the correct answer. First one says retinopathy, peripheral vascular disease, renal failure, joint pain, urinary incontinence, peripheral vascular disease. I think the A is our best option. A doctor requests a lactate test to be taken from a very unwell patient. What type of sample is taken? Choose the correct answer. I think that should be the blood gas. Scale 2 on the NIS2 chart is used for which patient group? So that is people with like carbon dioxide retaining, people with respiratory issues. So option A says those receiving intravenous therapy. Option B says those with a urinary catheter. Option D says carbon dioxide retaining patients, and that's our answer. Then D says those who have been exposed to carbon monoxide. Now, next question says patients with chronic pain conditions are screened for which of the following? Choose the correct answer. A, coronary heart disease, B, schizophrenia, C, bowel cancer, and D, low mood and depression. So I think it should be coronary heart disease, but then I'm thinking it could be low mood as well, because people with low mood could pretend to be having, or they could think they are having pain, even though they are not. So I will just go with low mood and depression here. Which of the following groups has the highest rate of suicide? Not children under 18, not women, elderly over 75. No, it's men. I'm 100% sure it's men. A patient presents with a productive cough, low saturations, high respiration rate, raised lactate with news 2 of 9. Oh my god. Productive cough, low saturations definitely seems like chest sepsis, not bowel obstruction, because the person should be having constipation, not deep venous thrombosis, because that means, you should see engorged veins on their lower limbs, not myocardial infarction, because they should be having, I think, shoulder pain, left shoulder pain mostly. So chest sepsis. Prior to surgery, how long are oral fluids withheld? Choose the correct answer. So I think for this question, our correct answer is 2 hours. Over here in the UK, it's 2 hours. Which group of drugs are used in patient-controlled analgesia? Choose the correct answer. So this question is a mind twister. What they are basically saying is, which group of medication belongs to controlled medications? We have option A, which is steroids, option B, paracetamol, option C, non-steroidal anti-inflammatory, option D, opioids. And we know the only listing here is opioids. So we go to the next question, which says, patients who are put on furosemide are warned of which common side effect? Choose the correct answer. So furosemide is also known as what? Lasix. And like, I'm so thrilled with how nursing in America and some other parts of the world practice nursing almost similarly to the way it's practiced in Nigeria. It's mind-blowing. When I say that, let me not digress too much. Anyway, so we have option A, which is constipation. Furosemide causes frequent urination. So I think our answer here should be polyuria, which is our option D, not diarrhea, not oliguria, not constipation. And I hope we both know what all this means. Constipation, difficult stooling, oliguria, scanty urine, diarrhea. So the next question. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. 5 abdominal thrusts. Give 5 more back slaps. Start basic life support. Monitor the patient. We know after back slaps, it's abdominal thrusts. So our correct answer is A. You are caring for a patient who has stoma formation and they are ready for discharge. What advice do you give the patient? Choose the correct answer. A. Clean with water, trying to keep fecal fluid from skin to minimize irritation. Wait until the bag is full before changing it and clean with soapy water. Use perfumed soaps to aid odor control. Keep the area moist when changing the bag, advocating the use of oils to help the surrounding skin. I think the best option is to clean with water and to try as much as possible to keep fecal fluid away from the skin to minimize irritation, because if there's no fecal fluid leakage, if it's well cleaned, there won't be any smell, there won't be irritation. So our best answer for this question is option A. Next question says, what is the responsibility of an occupational therapist? So an occupational therapist, A, assess injury or damage in a patient. Assessing someone's ability to see, definitely not. Supporting people whose health may prevent them from completing their normal activity. D, reviewing and adjusting prescribed medications. I most certainly think that our best option is option C. Whose role is it to lobby to the government to support nurses and make positive change to the profession and working conditions? Choose the correct answer. A, the individual team of nurses. B, the human resources department. C, the chief executive of the trust. And D, nursing unions. I think it should be nursing unions. Yeah. What does it mean to be? I honestly feel like this is similar, honestly. So, what does it mean to performance manage an employee? Choose the correct answer. A, developing a person to fulfill the expectations of their role. B, when someone is being dismissed from their workplace. C, when performance is exceeding the expected level. And D, when a person is promoted. I think the correct option here is A, because it's like they're trying to see where you may have shortcomings and like help you maximize your potential. So the best answer for this question is option A. When running a ward or unit, which of the following is the priority at the start of the shift? So at the start of the shift, one thing you need to do is to make sure you have enough staff for your patient ratio. That's it. That is it. I've not even checked the options, but I know that. A says calling and updating family or carers on patients' conditions. No. To give out the breakfast. No. Check the staff numbers match patient's acuity. Yes. You don't need a doctor on the ward. When supervising a student nurse, when do you deliver feedback? Choose the correct answer. Option A says midpoint at the end of a placement. Option B says feedback is provided by the university, so you don't need to deliver this. Option C says continuously throughout the placement. Option D says at the end of the placement. So feedback is to be given continuously throughout the placement. Continuously. What is a whistleblowing policy? I've talked about this in some of my previous videos, and a whistleblowing is like, you just doing a sort of biberong of the bad things that is happening in the place where you are working, but you're like trying to like cover yourself. So a whistleblowing policy sort of like protects you and helps keep you safe, basically. So option A says a major incident policy. No. Option B says a policy that helps employers manage staff. No. Option C says a policy that guides staff on raising concerns about safety and practice. I think that's our answer. When undertaking research, what is the first step? Choose the correct answer. It's to have a topic. Yeah, option B. It's to have a topic. There's no no discussion. I know that's the right answer. So what is the main purpose of a root cause analysis? When you are doing root cause analysis, you are trying to find why something is happening so that it does not happen again in the future. Basically, a tree is getting spoiled, it's getting dried up because it's not being watered, or a flower is getting dried up because it's not being watered. You're trying to like find out why is this flower getting dry. You know that it's because it's not being watered. So you water it so it doesn't dry up anymore. And in that way, you prevent that from happening ever again. Okay. So let me go through the options now to see. Option A says to assess if those involved require compensation. No. To identify who was responsible for the incidents and performance manage them. Option C says to provide data of the incident to know. Option to ensure that reoccurrence is avoided. That is our answer. Who will notify an emergency department that a major external incident has happened? Choose the correct answer. This is a tricky question. Don't let it confuse you. So the option A says the hospital press lead. No. Option B says the nurse in charge of the department. Option C says the reception lead. No. The best options should be the ambulance service lead, because they are the ones that are like in charge of those emergency, major external because it's the ambulance that will inform them, like, we have an incident somewhere and we need you to go there, probably bring them to the hospital, or just see if they can be managed at home without bringing them to the hospital. So yeah, D is the best option for this question. When noticing that a colleague is suffering from low mood and depression, what actions should be taken? Choose the correct answer. So the first thing you are supposed to do is to make sure you speak to them first. You see what is wrong with them and see how you could probably help them in some way. You don't just go ahead and report, which unfortunately does not happen. It does not happen. Most people will just go and report you once they see you are like in a low mood, or if they ask you what's wrong and you open to them, they just go ahead and report you to the management. I don't know about NHS because I've never worked in NHS and I've never really had such discussions with people in NHS, but I know these kind of things happen in care homes. So let's just go through our options and see. Option A says to provide and support and guide them to well-being services. Option B says to contact their next of kin and discuss. Option C says inform their manager without telling the colleague. Option D says refer them to occupational health without discussion. Yes, so based on what I said earlier, our best option is option A. What has been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions? Choose the correct answer. So option A says ensuring students have maths and English GSCE. Option B says Royal College of Nursing online modules. Option C says new pre-registration education standards. Option D says preceptorships training. So I think it's the new pre-registration education standards. Who is in attendance at a child protection case conference? Choose the correct answer. I don't know, but I think it should be option A says the team supporting the parent or carer only. No, I think it should be all those involved with the family from health, education, and social services. I think so. What document could help a nurse understand the preferences of a patient with dementia? We have A to be the most recent discharge summary. No. B says the patient's drug chart. No. C says a handover sheet. No. And D says a this is me document. Yes. A this is me document is basically like their CV. Let me put it that way. Like it entails everything about your resident. So the next question says, who should be notified when attending hospital with a school child aged 8? Choose the correct answer. A, the police. No. C, the local children's center. No. C says school teacher, and D says school nurse and public health community nurse team. I think it should be the school teacher, honestly. I'm not so sure, so I'll just flag for review. Next question says, there is a requirement to increase nursing staff on a ward due to an increase in patient demand. What steps are taken? Choose the correct answer. A, ask them to increase their working hours. Obviously not. B says reduce the number of... No. C says go directly to human resources and ask them to recruit. No. D says a business case is written to increase nursing staff numbers. I think D, yeah, D still sounds more reasonable. When failing a student for professional values, what steps are taken before the end of placement? Choose the correct answer. A says a midpoint interview where you give feedback and allow students to develop an action to plan. B says no steps required as long as the fail is documented clearly in the assessment document. No. C says inform your line manager so they can inform the student. No. D says contact the university and get them to inform the students they have failed the placement. No. So I think the best answer is A. Which of the following is a framework used to identify areas for development? It's SWOT, I think. SWOT or SWOL. Don't ask me the full meaning. According to Rogers' theory of nursing, which of the following are described as core conditions to effective communication? Choose the correct answer. It's congruence, empathy, and respect. B says sympathy, respect, and regard. No. C says empathy, respect, honesty. No. D says spiritual understanding, sympathy, congruence. No. So our best answer is congruence, empathy, and respect. Motivational interviewing is best described as dash. Choose the correct answer to complete the sentence. A says a tool used in appraising staff for development. B says a method of assisting people with health behavior change. C says a method used to encourage people to adhere to discharge advice. D says a tool used in peer supervision. I'm a little bit confused, to be honest. I'm not so sure. But I think I would go with A and let us flag for review. Next question says, what is the best method of delivering advice to patients with a new diagnosis of a long-term condition? Choose the correct answer. A says advise the patients to look up any questions about no. B says information and diagnosis is given by a consultant, so questions can be answered effectively. I don't think so. Ensure there is a range of materials available and present for the patient to take home after the consultation. Yeah. D says give all information at once. I think C is the best option. Not too sure though. ANTT refers to dash. Choose the correct answer to complete the sentence. So it is aseptic non-touch technique, which is our option C. Which of the following is not considered to be an aerosol procedure? And we've talked about aerosol procedures and we say something that has to do with airborne. So I think the best option here is blood transfusions. A wheeze is commonly heard on auscultation. Let me take that again. A wheeze is commonly heard on auscultation in which of the following conditions? Choose the correct answer. A. Acute asthma. B. Pleural effusion. C. Pneumothorax. And D. Pulmonary edema. I think it is acute asthma. Hematemesis refers to what condition? Choose the correct answer. Heme, blood, temesis, and vomit. Option A says blood and sputum, no. Blood and vomit, yes. Blood and stool, no. What would be the one in stool again? Hematuria is blood and urine. When caring for patients at the end of life, if a family reports that they are concerned that the patient is suffering from dehydration, what action is taken? Choose the correct answer. A. Advise the family this is a common symptom that is unable to be resolved. B. Ensure subcutaneous fluids are commenced. C. Ask family to encourage oral fluids. And D. Start measuring the urine output to diagnose dehydration. I think the best... This is a little confusing because someone at end of life, we have to take note of their urine output anyway. So I'm doubting between B and C, but I'll just go with B. I'll just go with B and flag for review. Okay, so for what clinical condition would a patient be on clexazepine? Choose the correct answer. A says psychosis in Parkinson's disease in patients unresponsive to homeopathic therapy. B says psychosis in Parkinson's disease in patients responsive to conventional antipsychotic drugs. C says schizophrenia, including Parkinson's disease. To be honest, I'm not too sure because I'm not a mental health trained nurse, but I think it should be C. It should be C. when like in advanced conditions or when they are unresponsive to other antipsychotic drugs. So those who have been diagnosed with postpartum psychosis are seen within which group of patients? Choose the correct answer. I don't know. These options are kind of weird. Option A says women who have given birth. Option B says the older person over 75. C says children under the age of 18. And D says neonates. So of course it's only women who have given birth. The 5-year forward view explores mental health provision for the following of the United Kingdom. For the population, let me take that again. The 5-year forward view explores mental health provision for the population of the United Kingdom. Which statement reflects the prevalence of childhood mental health needs in the UK? Choose the correct answer. Option A says half of all mental health problems have been established at the age of 14, rising to 75% by age 24. Option B says all mental health problems are established by the age of 5, rising to 50% by the age of 18. Option C says all mental health problems are established at the age of 14. Option D says mental health problems cannot be established in childhood. I think mental health problems cannot be established in childhood. It would be difficult. Okay, next question says, a mental health nurse is supporting a patient at risk of suicide. When is the risk highest? Choose the correct answer. A, at busy periods on the ward. B, after assessment by the consultant psychiatrist. C, prior to discharge. D, in the transition from continuous to general observation. I think that should be busy periods on the ward because, you know, the nurse may lose sight of her or him and be busy with some other things. What can assist in minimizing the risk of violence to staff in mental health services? Choose the correct answer. A says single point alarm systems. B says behavioral therapy training. C says de-escalation training. And D says mindfulness training. I think it is de-escalation training. Okay, so we are through, guys. We got 45 correctly and 5 incorrect. So let us review those ones that we got incorrectly. Oh, I knew it. Why did I? It should be cervical. So the human papilloma vaccination prevents which disease? Should be cervical. I don't know why I keep messing it up with ovarian. And this one should be, is it administering immunizations? So this one should be supporting the physical and emotional growth of a child. So this one says, who should be notified when attending hospital with a school child aged 8? So that should be the school nurse, public health, community nurse team. I knew it. I wasn't so sure. So this question says, motivational interviewing is best described as dash. Choose the correct answer to complete the sentence. So definitely not a tool used in appraising staff for development. So it should be a method of assisting people with health behavior change. Yeah, that was right. That was right. So I don't know about this, to be honest, because I'm not a mental health nurse. Oh, okay. Let me just check them again. So 48 says the 5-year forward view explores mental health provision for the population of the United Kingdom. Which statement reflects the prevalence of childhood mental health needs in the UK? Choose the correct answer. So it is that half of all mental health problems have been established at the age of 14, rising to 75% by age 24. So that is it. Then which question was left? I can't remember the question that missed earlier. That motivational interview. Oh, this is it. Okay. So it says motivational interview is best described as a method of assisting people with health behavioral change, just to emphasize on that. So, and that is it, guys. Everything is cleared. We got 45 over 50, which is not too bad for someone who is not a mental health nurse. So if you enjoyed this video, make sure to give it a thumbs up, comment, like, share, and subscribe. Share with your friends so you know will find this video helpful. And I hope to see you in subsequent videos. So until next time, bye.